with the condition. And so let us begin. Dr. Tulloch-Reid, explain to us basically what is lupus?
So that's a good question, and many people are confused by the term. I like to first start off by saying what it's not. So lupus is not cancer, and also lupus is not contagious. You can't get it from anyone.
It's not HIV.
Or give it to anyone,
Okay.
right? Lupus is what we call an autoimmune condition. And so I think many of our listeners or viewers are hearing that term a lot these days. And what that really means, it describes any condition, usually by fighting off bacteria, viruses, and so on. But instead, the immune system becomes dysfunctional and turns against healthy tissues and organs. Pardon me.
That's okay.
And this can result in inflammation and there. But lupus is considered one of the most serious because with lupus, almost any organ or tissue can become involved.
So let me just interject. So are you saying that anybody can catch lupus? Anybody can be diagnosed with lupus?
Actually, yes. Lupus can affect anyone. You're not born with it. But there are certain groups that seem to be at high risk of developing lupus.
There we go.
And unlike most of what we call most chronic conditions that we're talking about, lupus is considered a disorder of the young because the average age of onset is actually 22. So up to, especially at the young. And we also know that it predominantly affects females because there's a 9-to-1 ratio there in terms of females.
I hope our listeners our viewers are listening rather. And Dr. Tulloch, I'm so sorry to cut you, but you did say it presents in different forms in terms of symptoms. What are those symptoms, if you don't mind sharing with us?
Absolutely. The symptoms of lupus can vary widely. Sometimes they call it a disease of many faces because of the different ways it can present itself.
Right.
Some of the common symptoms that you may encounter, though, are non-specific, what we call constitutional symptoms, feeling tired, fatigued, multiple joints at the same time, small ones, large ones. Unusual skin rashes are another way that lupus can present itself, and very often in sun-exposed areas. So the symptoms can go on and on. I mean, persons who have kidney involvement may actually develop leg swelling as their first clue that something is going on with the kidney. Depending on the organ, I mean, lupus has been known to present itself as seizures, confusion. If it involves the nervous system, then it can involve the heart, the lungs. So, there can be a variety of
different types of lupus when I was studying back at UTech. But do you want to just dive a little into some of the types of lupus that we do have and the most common one that you might see here in Jamaica? Yes,
so that's worth discussing. Most of the time when we use the term lupus, we're speaking of systemic lupus. So that's what we just described, which is a condition that affects only the skin. So if only your skin is involved and nowhere else is involved internally, then we call that condition. It's not quite the same thing, but you may hear it around. It's not quite the same condition. For instance, you may hear drug-induced lupus. Well, that's just a condition where people may develop a rash and joint pain in reaction to a drug, but of course it goes away when you stop the drug. So babies may be born with to people who have a certain antibody that mothers have. So the baby doesn't actually have the disease lupus, but they present with this. So the main thing is systemic lupus, and then there may be discoid or cutaneous lupus if it only involves the skin. So basically we have 4 main types of lupus then. You could put it that way.
Alrighty. And my final 2 questions to you, because I'm coming to you, my survivor.
No problem.
How is lupus diagnosed?
Yes, so lupus can sometimes be difficult to diagnose, sometimes straightforward. The most important thing is for persons to be clued in that something is wrong. So somebody presents with one of the symptoms that we described earlier. They're having joint pain, having rashes, their fingers are turning different colors, they have ulcers in their nose or mouth, something's happening that's unusual. They may present themselves in one of the ways we described, or anemic, low blood count. But having presented with the symptom, the physician would now inquire, ask about other symptoms and signs, examine the person carefully, looking for things that may suggest that lupus, and then lab work usually follows.
So I was about to ask you, what tests can be done to
contains that body to your own?
You know, I heard you said...
I know that's very often persons are hoping that this is something that just disappears. And that's one of the things that can be misleading. We don't actually have a cure yet.
Right.
We're getting there, and the treatments are getting much better, but you really should be monitored on a regular basis. Even if you feel better.
There's no cure for lupus. However, there because lupus survival. Lupus for you. And you know, we emphasize a lot about person living with lupus, but actually to live it is another thing. And so if you don't mind, tell us.
In the year 2007, so you can think it's 16 years and over, a lot of years. But when I was diagnosed, I only know one person living with lupus, and recently the person died. So all I was thinking, rheumatologist, and after going to the rheumatologist, and he explained it to me and stuff like that, I feel more confident, and then I start to learn about the illness. After learning about the illness, I'm better able to be living with it. Yes.
Of what lupus is about.
Yes.
So it was the...
I was just diagnosed, so over the years my liver...
Been living with lupus. Has it changed? Has it changed your life? How has it changed your life?
Over the years I developed other symptoms. I developed rheumatoid swelling. Over the years I developed other symptoms. I developed rheumatoid swellings. Yes.
And for her to be sitting here and telling her story, what would be your...
That ways acknowledging order, that is what works for me. So you can be encouraged.
Beautiful, beautiful. If there's anyone that has any questions for our presenters today, Sean.
So you're maybe referring to the support group.
Support
so that's
group,
one of the... we have a number of them, but and Lupus Foundation, for those who don't know it, Lupus Foundation is a member-based organization. It consists of patients. And one of the activities that we organize in support is actually monthly support group meetings. So there's actually a group in Montego Bay, and there's a group in Kingston that meet alternate months, in person or online. And that's, you know, covering different topics, you know, allowing persons to share their experience. And it's really been a tremendous encouragement and a wonderful source of knowledge, because, you know, as you're hearing, knowledge is so important.
Definitely.
In the fight against lupus.
Definitely.
It's one of the weapons.
So there you have it, everyone. You'd have heard from Dr. Tulloch-Reid. She is the president of the Lupus Foundation of Jamaica, and we have Mrs.
Davis-Campbell.
Davis-Campbell. I'm so sorry. Our warrior. I'm so fixated on her journey, especially when I have someone so close to me. So pardon me. And we just want to send all the love to persons who are actually fighting this condition. And we want to thank you, ladies, for joining us this evening. We have been given a wealth of knowledge, and I hope our viewers are actually soaking all of those information up, because we truly want to impart and keep the awareness going even outside of the month of October, which is very important. So ladies, thank you for joining me. It's been very cozy up here with you guys. And sending you lots of love.
Yeah,
lots of love. Blessings be to you.
Blessings, thanks.
Blessings be to you. Up next, we will have... So as you heard, we have just discussed lupus from the perspective of a warrior, as well as what the Lupus Foundation of Jamaica is doing and the work that it has been doing. You have heard the condition, how it greatly affects the persons who are diagnosed financially, socially, emotionally, professionally, and otherwise. Thankfully, there are organizations such as the National Health Fund that has been committed to providing the necessary support. We'll now be talking with Mrs. Katherine Dawson Shaw. Manager of Individual Benefits and Research, and she now joins me.
Hi, Tia.
Pleasure is mine. Two lovely ladies. And clinical pharmacist and chief at DrugServe Kingston Public Hospital, Dr. Deidra-Kaye Henry-McKoy. Hi, ladies. How are you?
Hi, Tia.
Hi.
They're so
Not
pretty. So
Hi
pretty.
to the listeners and viewers.
And our listeners in radio, like I see Candy sending love, and Maureen sending love, and that is Karen Henry says, we love you, Nicole. Vanessa Davis says, proud of you, my sister. So she had her support system here tonight, and we just want to send you again all the love, Nicole, that we can send you. And see, so important for your support to show up, because our support is even here with her tonight. As we move into the next phase, at me, even though you see me looking, if I'm not looking at you viewers, it's my producer staring at me to tell me that the time is going. So we're just jumping right into it. How does the National Health Fund support its beneficiaries with lupus?
Okay, so we cover 22 conditions currently, and lupus is one of those.
Right.
We added it to the program in 2019. We have a list of 21 pharmaceuticals that we cover for the treatment, different strains, different brands. And anybody who wants to find out what we cover, they can just go to the website. There's a brochure there that says what we cover, and the subsidies are there as well. So they have an idea of how much support we are giving, depending on what they're taking.
And all the DrugServe across the islands give support to our lupus beneficiaries.
Oh yes, I'm sure you, in your arsenal of pharmaceuticals, you have items there that treat
Right.
lupus.
So I just wanted to highlight that, because
Yes.
the National Health Fund is actually doing so much for our
Yes,
patients.
yes.
Right. So tell us a little bit more about how does one acquire a NHF card if it is that they are diagnosed and they want support from the organization?
So for any Jamaican citizen, irrespective of age, gender, parish, whatever,
Right.
there's an application form that we have. Section A is completed by the individual who is affected. Section B, if it's a minor that we're talking about, somebody under 18, somebody who can't assist themselves, a guardian is in post.
Right.
Section C is where the physician is going to indicate the condition. And of course, we are funded by taxpayers' money, so we want to make sure that everything that we're doing is above board and we're able to be scrutinized and have clean hands.
Right.
So the doctor is going to indicate, they're going to sign, their Medical Council of Jamaica number will be there, form submitted, one of our 20 locations island-wide, so you don't have to come to
Right.
Kingston to get a card.
Very important for them to know that.
Yes, and you can leave your doctor's office with the diagnosis, head to a location, hand in the form, and in short order you have your card proceeding to the pharmacy.
Perfect.
Yes, it is.
Perfect. How can someone get an NHF card though? In the sense that when it is that they have already applied, is it a case that they have to come in, somebody gets in contact with them to come and collect? Because that's another common.
No, you're going to wait. So you show up at the office
Right?
with your form, and sometimes while you're getting ready to sit down and start on your phone, WhatsApping or whatever, your name is called and the card is ready. I should tell you as well that there's online registration, which some physicians do. And of course, if you're helping somebody who may be having a little problem getting out, they can just send a letter authorizing that you collect on their behalf.
Okay.
So we make every effort to support persons who are going through a difficult time.
Indeed. How many of those, do you have an idea of how many support NHF is given to those persons?
All 6,000 can enroll.
All 6,000?
Can enroll. With how the periods where there's pain and whatever else, then we may see increased utilization.
Right. And lastly, as it relates to the NHF card, if one loses their NHF card, how is it that they go about? And when I say a lupus warrior, when they lose their NHF card, how is it that they go about?
Any other beneficiary for any of the other 21 conditions, the beneficiary application form, they're going to complete that. Right at the top, they're going to tick that what they want is a replacement card.
Right.
And I should tell you that you don't have to wait to add lupus. Let's say somebody, God forbid, they're living with diabetes and another condition. What they're going to be doing is adding lupus because we're not there in segments for just one condition.
Compartmentalize the conditions.
No,
Right.
you can have the card for multiple conditions
Right.
depending on your health status.
Right.
Yeah.
So if there's anyone that you know is
So the NHF supports their also treat conditions that provided
okay. So basically because
patients.
the days she's not.
It is very important. As our survivor would have indicated, she might where one of the patients on what else. You might have drugs that are used to manage these conditions.
Or clinical pharmacists, and before you wrap up, just tell us, because I think what a lot of our lupus people not getting a response. So that people not getting a response. So the active pharmacist is a clinical pharmacist.
It depends on what it is the therapy is being used for. So if we look on our immunosuppressive therapy, some to manage the lupus.
Right. Wow, so much information we know about the public-private partnership with lupus that we have your card. It can be updated.
I noticed that there's a question that's coming up there.
Yes, are the first line
Activity. And depending on what is happening with the
Catherine.
22.
thoughts, I want to encourage patients that when they are prescribed therapies, it's very important to take them exactly as they are prescribed. As
What are
Tulloch-Reid would have highlighted the organ systems that are involved, the things that you're exposed to in the end.
trigger inflammation? I think piggybacking off one of
So-
and ladies, thank you so much.
Pleasure.
Thank you.
You guys have been such excellent participants. I didn't do anything, guys. I'm only here keeping the your pharmacist. You may also read more about the conditions covered on our website. And in addition, we are on Instagram. I hope you were armed with the necessary for also living with lupus. I was your host for this evening. Have a good one.
Bye-bye.